Howdy and welcome to another video edition of Remedyland. Today I want to talk to you about toothache. Pulpitis result from an inflammatory reaction of the pulp inside the tooth. The pulp belongs to the interior of the tooth containing cells and nerves. Just like many bacterial infections, the human body responds with raised blood flow and the delivering blood vessels enlarge. A toothache typically comes after damage to the tooth. Tooth pulp is a material in the middle of the tooth comprised of connective mass and tissue. The best known type of damage to the tooth is from tooth caries or perhaps a cavity. Oftentimes this is a consequence of inadequate tooth hygiene. Glucose and also starch in meals are the elements that lead to problems for tooth. A tooth with acute pulpitis is very responsive to temperature range and occasionally in extended severe pain. The discomfort is a consequence of the tension of the pulp because it swells against the inside surfaces of the tooth. In pulpitis acutis erosa, prolonged capillary blood vessels produce the excretion of granulocytes as well as serum. Generally it truly is a result of dental caries which could enter via the teeth enamel as well as dentin cellular layers of the tooth to get to the pulp, or perhaps by damage that destroys those layers. Constant damage on the other hand may possibly lead to the pulp to get inflamed without bacterial infection. That may be the consequence of a misaligned jaw, or perhaps grinding in the bedtime. Symptoms of pulpitis or a toothache. The signs and symptoms of a toothache can look like some other health problems or dental conditions. A toothache is commonly identified according to an entire background and physical exam. The following are the best known signs and symptoms of a pulpitis. Signs and symptoms may contain continual pain in a tooth is hurtful to contact, discomfort in the tooth that worsens with warm or perhaps frosty meals or drinks. Tooth typically responds to sugar, the jaw near the area of the tooth is painful and sensitive to contact, fever, tooth abscesses may appear in case that pulpitis is progressed. In case the pulpitis is not very advanced, the discomfort vanishes from the moment the issue is removed. In case the pulpitis is progressed and possibly irreversible, the discomfort lingers for quite a while. Chronic pulpitis at the same time is usually entirely without signs and symptoms. It is almost always a result of caries. White blood cells build up in the pulpa to fight swelling. In reversible, acute pulpitis, the tooth responds to sweetness, cold and also high temperature. The discomfort can last for a few moments merely. In irreversible pulpitis, that could be acute or perhaps constant, the tooth is irreversibly agonizing. The dentin is usually damaged around the pulp or cavity and cariously modified. Discomfort proceeds despite the fact that caries is eliminated. The affected pulpa will never be restored to its genuine natural condition. It really is irreversible. Mainly eliminating the irritant from the pulp is not really adequate to prevent the pulpitis. In those occasions it is crucial for the pulp to be taken away by root canal. Strength loss of the tooth marrow will cause pulpal necrosis, which at first shows absolutely no signs and symptoms. It might happen via a bacterial inflammation, for example gangrene, or perhaps after damage without the involvement of harmful bacteria. Treatment for pulpitis or a toothache. Therapy for toothache in most cases start by dealing with the reason for the pulpitis that should include the elimination of any kind of irritant. Precise treatment for a pulpitis is going to be established according to medical background, degree of the situation, tolerance for particular treatments, techniques, or remedies, and also therapy may contain antibiotics, complete or perhaps incomplete tooth extraction, discharging of an abscess. It may be required for the pulp to be taken out by root canal, a medical operation that includes the elimination of the affected nerve and also cells from the center of the tooth. In the event that the condition is neglected, anaerobic putrefactive microbes degrade the dead cells and even lead to gangrene. I hope you've enjoyed this video edition. We'll see you again on another video edition of Remedyland. Take care.